Today we'll be looking at diagnostic microbiology, which is the clinical specimens or the tests that we take on patients to diagnose certain conditions. The aim of this study session is to identify the causative agents of infections. So, different infections have a different way of being tested. Others manifest in urine, others in blood, others in any other test. The most common test would be blood, because most infections would settle in the bloodstream. So most patients will have blood taken to screen them for any of the blood-borne diseases or any of the infections that appear in the blood. The other one that's most common as well is urine. You test most of the infections or illnesses or conditions using urine. Mostly your UTIs, urinary tract infections, would be identified through the use of a urine specimen test. Another test would be stools. Stools are used in detecting intestinal pathogens. Also, they can be taken to check for GI bleeds when the tract has a bleed. And also we have wound swabs, which is when a swab is taken from an open wound to check if there are any surgical site infections or abscesses or any infections on an open wound would be detected by using a wound swab. The other kind of clinical specimen would be cerebrospinal fluid, which is the fluid that is within the brain and the spinal cord. This is to diagnose any of the central nervous system infections, like most commonly your meningitis would be tested using the test of a CSF done by a lumbar puncture. And then throat swabs are done where a swab will be taken from the throat to diagnose either pharyngitis, which can also be visible just by observation, also to check for Streptococcus pyogenes, which are infections that are common around the throat. Genital swabs are done to check the causative organism for STIs. So some STIs, like where you get a purulent secretion, would be detected by a genital swab. All specimens that are done or taken from the patient needs to be timed according to the time reference, and also a proper technique needs to be done to avoid contamination, because you might be taking a specimen from a patient and the specimen gets contaminated. The results then become wrong. It won't be what is expected. Thank you, and we'll see you on the next one.